Hello, welcome to Nursing with Professor B. My name is Bridget. I'm a family nurse practitioner. In today's video, I'll be going over 5 NCLEX style questions and explaining the rationales. Without further ado, let's get started.
Okay, so NCLEX practice. So question number 1 is, a client is becoming violent toward the staff. The nurse decides to enforce behavioral health restraints and seclusion to protect the client and staff. Which principles must the nurse consider before implementing this type of restraint? Select all that apply. Okay, so the key word here that we have is violent. They're going to use seclusion and restraints, and it's a select all that apply question. What I want you to remember is that seclusion and restraints are always a last resort. It is not punitive. It is not to punish a patient. It is a last resort. It's not something that we jump to. The first answer says the nurse should not harm the client, even if the client harms the nurse. The second response is, compared to medical restraints, behavioral restraints should be used as an early option for behavioral control or behavior control. So remember what I just said, that restraints are a last resort. Would you yourself want a stranger? I'm not talking anything kinky here. Would you yourself want a stranger to grab you, tie you to a bed, restrain you, and you are completely immobile? That would be absolutely terrifying for me, because you are no longer in control and you are at the mercy of somebody else. So they are not an early option. Seclusion and restraint is never an early option. C says an orthopedic appliance that is being used for treatment by the client can double as a behavioral restraint. No, and the client should have constant one-on-one monitoring. A lot of stuff can happen while someone is in restraints. If they vomit, they could potentially aspirate. So they need constant one-on-one monitoring to make sure that they don't have any circulation issues, that they're still breathing. That is why A and D are the correct answers. Even if a patient kicks you, you have a right to run away, you have a right to block the hit, but you can never strike back at someone, at a client or a patient that has hit you. So this is from nursing.com, these questions. My affiliate link is in the description in order for you to get a discount. And what I like about nursing.com is that they have NCLEX style questions, but they also have rationales. So you can read through this rationale on your own. I'm not going to read to you because you know how to read, so feel free to pause and read. But the correct answers, again, they're not in the same order that they were in the previous slide, but the client should have constant one-on-one monitoring, and the nurse should not harm the client, even if the client harms the nurse. And the big teaching point I want to drive home is that behavioral restraints are a last resort. A client with a brain tumor has set up an advance directive and has selected her son as durable power of attorney. Upon admission to the hospital, the client tells the nurse, "I do not want my son to make decisions for me anymore. I want to change my directive." Which response from the nurse is accurate? You can change your power of attorney, but you would need to fill out appropriate paperwork and contact your attorney first. I'm sorry, once you have set your son as your POA, you cannot change it. You may change your power of attorney to someone else, but only one time. You may change your POA. I will tell the provider and we will change it in your chart. So which response is accurate? Keep in mind that a power of attorney is a legal document. And if it's a legal document, then an attorney had to have drafted it. You are not a legal attorney, you're a nurse. And even a healthcare provider does not have the power to change that legal document. So what do you think the correct answer is? So the correct answer is you can change your power of attorney, but you will need to fill out the appropriate paperwork and contact your attorney first. So the important teaching point here is that an advance directive is not a power of attorney. Patients can change their advance directive. So an advance directive it basically guides decisions when you reach a point that you are unable to make decisions for yourselves. So with nursing.com, they provide not only NCLEX review and NCLEX style questions, but they help students, especially those that have ADHD, like myself, I have ADHD. They help students with ADHD, and they have lessons and they accompany you throughout school. So they have like med-surg lessons, they have lab videos, all sorts of videos and cheat sheets to help you learn while you're in nursing school, to supplement your curriculum in nursing school. A 60-year-old client with coronary artery disease is being seen at a cardiology clinic for care. The nurse performs the intake assessment and asks the client some questions about his health history. Which of the following questions would assess for signs of chronic, this is the key word, chronic stressors in the client's life? Do you take your medication every day? How often do you exercise? How do you like your job? Would you say that you follow a healthy diet? So what would be inflicting stress on someone? How would we assess? We're assessing, right? Keyword here, we're assessing for chronic stress. The best answer is, how do you like your job? It's an open-ended question. We're exploring, and that's going to be the correct answer. How do you like your job? Chronic stress, it contributes to poor health and worsening cardiac symptoms. So like I said before, I really like the rationales. You can read through them on your own time. Question number 4. A client has a nasogastric tube placed after developing a paralytic ileus following surgery. The nurse maintains the NG tube and performs interventions to ensure adequate hydration for the client. Which intervention is closely associated with assessment of fluid intake and output in a client with an NG tube? So is it A, noting insensible fluid losses from the client's perspiration, hyperventilation, and wound drainage? Is it assessing daily for peripheral edema? Is it monitoring for cognitive changes in the client's neurological system? Is it determining whether the client has abdominal pain? What is the keyword? They have an NG tube. Yes, they had a paralytic ileus. But which intervention is most closely associated with intake and output? So, intake and output, this is going to be your best option. We lose fluid through perspiration. We lose fluid with hyperventilation and wound drainage. So this is the correct answer. The last question is, a 22-year-old client has suffered a spinal cord injury in which he is experiencing spinal shock and cannot feel his legs. 24 hours after the injury, the client tells the nurse, "This will be good for me. I can handle this and I'm doing fine." Which response from the nurse is most likely indicated? Is it document the client's positive attitude regarding this life-changing disability? Is it make arrangements for the client to be discharged to home? Continue to treat the client as is, but remind him that he may never walk again? Or ask the client if he would like to speak with a spiritual advisor or social worker? The correct answer is, ask the client if he would like to speak with a spiritual advisor or social worker. The reason for this is because the patient is most likely in denial. Think back to Elizabeth Kubler-Ross, and she talked about the 5 stages of grief, but this just happened. There's no way that he's already accepted what happened to him. So the best intervention is, if you just went through something traumatizing like this, is to offer to the patient if they would like to speak with a spiritual advisor or a social worker. We don't know if he will or will not be able to walk again because he is currently in spinal shock, right? Officially, he has not been labeled as a quadriplegic or a paraplegic. So again, the best intervention would be this one. Thank you so much for watching. If you enjoyed this video and you would like me to do more NCLEX style questions, drop a comment below. Remember that these questions were obtained from nursing.com. My affiliate link is in the description below, and nursing.com is just a great resource for anyone that is struggling during nursing school with certain concepts. They have a plethora of resources on their website for you to explore. Make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell.